So it's been exactly a week since I had my ACDF surgery. What happened with me was several years ago, I had a pretty bad car accident that messed up my back and my neck. I had back surgery a few years ago on L4 and 5 that repaired that situation. But after the car accident, I had been dealing with neck pain for many, many years. And treated it with medications, all kinds of different treatments, chiropractic, acupuncture, steroid injection. I mean, you name it, I did everything. And then about 8 or 9 years ago, something changed, and the pain that I was experiencing was not just pain, it was now neuropathic pain that I was experiencing in my upper back and then all in my shoulder and all down my left arm. I only had the pain on my left, so I was hit on the left, had the whiplash on the left, and then that's where the pain ended up radiating to. So I spoke to 3 surgeons, and they all said that I was a candidate for ACDF surgery, but they urged me to wait as long as I could, because there is a risk of having additional surgeries on the upper and lower levels, because apparently when they put the titanium bracket in, they screw those in with 4 screws in the upper and the lower vertebrae. It can put stress on those other vertebrae, and then you can need ACDF surgery on other levels. So I followed their advice and waited as long as I possibly could. And it just got to the point where my quality of life was just so poor that I knew it was time to do it. So I had the surgery a week ago, and I thought I'd make this video because there were a lot of things I experienced that I didn't expect, and I wish I would have known beforehand going into it, and it would have made my experience, surgical and post-op experience, I think, much smoother and less, might I say, traumatic, because there were some traumatic parts to it. So some of the things I wish I would have known is that you really need to have your post-op pain management plan in place. So I have a pain management doctor, and so my surgeon preferred that my pain management doctor manage my post-op pain. Also, her nurse told me that she was very conservative and prescribed tramadol, which I used tramadol for years, and it just became ineffective for me after a while. And so tramadol was not going to be something that was going to be effective for me. So I did work with my my pain doctor, and he prescribed oxycodone. But what happened was, when I was at the hospital, I explained to them, first of all, I have red hair, so there's almost always issues with pain with people with red hair, or people who are sensitive to pain, or people who have fibromyalgia, which I also have. So I explained all of that to the surgeon and the anesthesiologist, and they assured me that they would administer Dilaudid, which was their preferred pain med, before I came out of sedation from the anesthesia, and so that we would, get ahead of the pain. But that was wearing off very quickly, and as soon as I got out of the recovery room, which, by the way, my insurance would only pay for outpatient, so they did not keep me in the hospital. So you might have insurance or a surgeon that keeps you overnight in the hospital, which, if that's the case, lucky you, because I think that that's absolutely what should happen. What ended up happening with me was, after I was out of the recovery room and they've moved me into a regular room, they would not let me take the oxy that was prescribed until I got home. And so by the time I got home, the pain was pretty unmanageable. And I had a lot of nausea from the anesthesia. And so I started vomiting in the hospital, just water, because that's all I was drinking, was sips of water at that point, because I hadn't had anything to eat since the night before. But I was dry heaving even a little bit, so keeping things down was very difficult. So by the time I got home, the pain was pretty bad. We finally did get control of the pain. And I was able to keep it down. I definitely needed to make sure I was eating food. You're probably not going to be hungry. Anesthesia really tamps down your appetite, so you're just not going to feel like eating, or I didn't feel like eating anyway. It might be different for you, but you do have to force yourself to eat because you're taking your pain meds. So I was taking oxycodone. They were also giving me a muscle relaxer. And then they were giving me Zofran to help with the nausea. So that's something I would suggest also when you talk to your pain doctor or your surgeon, that they have some Zofran nearby. So if you have some vomiting or nausea, that you have something to take care of that. Luckily, I had some leftover Zofran from my last surgery. And so when my husband told that to the nurse, she said, well, just give it to her when you get home. So again, by the time we got home, I was still very nauseated. So all of that was quite a mess. So once I did get settled in and the pain started to be managed, I was really worried about the sleep part of it, because I watched a lot of videos and a lot of people talked about how difficult it was to sleep. I should make a distinction here that there are two camps of surgeons. So one camp is neck brace. The other camp is no neck brace. And in that camp with the neck brace, they usually use bandages on your incision. And usually in the camp of no neck brace, they don't use an incision or don't use a bandage on the incision. So my surgeon is a no bandage, no neck brace type surgeon, which I was really thrilled about that, because when I had my back surgery, I had that at the Mayo Clinic in Rochester, and they also didn't believe in back braces or bandages, and they're absolutely correct. You heal a lot faster, your incision heals a lot faster, you can shower, you can get it wet, you don't have to worry about any of, the keeping it clean or anything like that. And sleeping is a lot easier, because what I had watched on many of the videos on YouTube was that people were, sleeping in recliners and, just really having a difficult time sleeping. So my doctor said, don't worry, you don't have to sit up, just find whatever position is comfortable for you and sleep in that position. So I didn't get much sleep that first night because there was quite a bit of pain. And I don't know, I just kind of had insomnia from all of it. I don't know if it just, all the trauma of the pain and what was going on just kept my brain awake. So I just couldn't fall asleep. But I was able to lie down and get fairly comfortable. And so I would recommend that you search for a pillow that's really comfortable for you before the surgery. So what I got was a contour pillow, and it looks like this. I got it on Amazon, and so you see how there's this curve, and so then when I laid on my side, and then it supported my neck like that. And so if you're sleeping on your back, then it would support your back that way. I tried sleeping on my back because that's the way I prefer to sleep, but it was much, much, much too painful. So let me tell you about where you'll experience the pain, or at least I experienced the pain. So what they do in the surgery is they make this incision here. Sometimes I've seen it a little bit lower, I've seen it a little bit higher, and sometimes I've seen it at an angle. I was really happy with the way my surgeon did it, because I think that's going to heal really nicely and just blend into that already line that most everybody over 40 has, or people who look at their cell phones a lot anyway. So they make that incision, and then they use a tool to open you up. So they're going to push everything aside. So your larynx, your breathing, all of that stuff, everything in your throat is being pushed aside so that they can get to your spine. So then once they push everything aside, then they remove the bad disc, and then they put in an artificial disc. It could be an artificial disc, which is made of a artificial material, or it could be a cadaver bone, which is what my surgeon used with me. Or there's another one that's something with a cage, but I don't know a whole lot about that. They put in the artificial disc, and then they fasten a plate onto the inside of the spine using 4 screws. And then once that's done, then they let everything come back to the middle, and then they suture this with glue. I don't know if all surgeons use glue, but glue is absolutely the best way to go. In my opinion, I had glue when I had my low back surgery, and I had about a 10-inch incision there, and it healed just beautifully. So I didn't have to worry about oozing or drainage or anything like that. The other thing that my surgeon did that I have to send her a thank you note for was she must have given me some kind of long-acting lidocaine, because I had no incision pain. The pain that I was experiencing the night of or the day of the surgery and then thereafter is because they put that cadaver bone in, it stretches everything up. So the ligaments and all of the tendons and muscles and everything like that are actually being stretched up. And so that just pulls everything and probably tears the ligaments and muscles and tendons and so forth. So you're going to have a lot of pain back in this area here. The other area that is actually even a little bit worse, not so much the first couple of days, but definitely the days following, is your chest muscles and everything going down here. So it's painful to swallow, not in the sense that it's scratchy or like when you have a cold and your throat is scratchy and sore, or like if you have strep throat. It's not like that. It's more of you can feel everything going down, and it's almost like it's just pulling at all of the muscles and tendons and everything as it's going down. And you can actually get, which I've been having, muscle spasms in this area when you swallow, after you swallow, and sometimes in between. So that's why they recommend muscle relaxers. And I had to make sure to tell them, because I'd been on muscle relaxers before, Flexeril, or I can't remember what the generic version is, cyclobenzaprine, I think it's called. Anyway, that one I've had before, and it just makes me itch like crazy. So I gave them that information ahead of time so that they were able to prescribe me something that wouldn't make me itch all night. And I'm still on those muscle relaxers today. And in terms of managing the pain, I believe that oxycodone is the absolute best. I know there's a lot of bad press about it, and there's been a lot of with the opioid epidemic and all of that, but with all of that going on, it is still, in my opinion, the best medication to manage post-operative pain, especially the acute post-operative pain. But the key with that is get it in early and keep it up. And even if you feel like I don't need it, I'm feeling a little bit better, still take it that first few days, because the pain will creep up on you. So I took the Oxy for about 4.5, maybe it was 5 days, when I started feeling like, okay, I think I might be able to handle this. And what I was doing was, first I was taking it every 4 hours. So it's supposed to be every 4 to 6 hours, but I knew once I got to the 4 hours, I definitely needed it. The pain would just come back like a vengeance. But I noticed around early day 4 that I was able to go 5 hours, and then even go 5.5 hours before it started to kick in. And now that I'm remembering it, I took it one more day. I took it 5 days. So then I did every 6 hours that 5th day. And then the 6th day, I was able to stop taking the Oxy. And then, of course, have something lined up that you can take instead, because you're not going to be pain-free. You're still going to have quite a bit of pain, especially in your chest, with swallowing, with breathing, and then this initial area back here is quite sore. So you should have something like Tylenol, extra strength Tylenol, ibuprofen. Now, I can't take either one of those because I have different allergies. So my doctor prescribed tramadol, which is also an opioid. It's a synthetic opioid, but it's a much lower level opioid. I also wanted to mention on the Oxy, make sure that whoever's prescribing your post-op medication, that they give you a prescription stool softener. Stool softeners over the counter do nothing for most people. And in addition to that, the prescription stool softener, I also was taking 2 glasses of Miralax a day. So that's a glass of water with a cap full of the Miralax. And that should keep things moving for you, because the constipation that you can experience from the oxycodone can be almost as excruciating as the pain, and you don't want to add anything to that. The other thing that you can do non-medication wise for pain is ice packs. And I bought a package of 4 of these from Amazon. I like the size because they fit really nicely on the back of the neck. If I'm leaning back, I can just put it right there. Or I can even put it on my chest to soften that pain up a little bit. Ice is really good when the pain is pretty high. I would say to keep your pain, once you've got it managed and it's moderate, I would suggest a heating pad. Now, I do have a regular heating pad, which I love, but I bought this one, and I'm just going to demonstrate it here for you because it's so fabulous. You put it over your head, and then a magnet holds it together right here. And this one has wires in it, so you can squeeze it around your neck, and then you get some heat here, and you get some heat in your upper back. And I got this on Amazon as well. So that is a lifesaver. I use that multiple times a day. I usually have it going when I'm resting in bed or resting on the couch. The other thing that, especially during the first couple of days, you're going to need a bendy straw. You're going to need to take a lot of meds, and you're going to need somebody to help you with that. And sitting up and drinking is very difficult. So having the bendy straw is really, really helpful for that. Now, speaking about somebody helping you, I wish I would have known this. Now, I had already planned that my husband was going to help me through this, but you really do need a full-time caretaker that first couple of days, at least the first 24 hours. I mean, you're drugged up, you're coming off of anesthesia. I don't know how many barf bags I went through. They sent home, I don't know, half a dozen or so barf bags, and we went through those. And my husband was just right there, ready to go to give me that so that I wouldn't make a mess everywhere. He also started a log, so then he would, a tablet, and he would write down when he would give me the medications, so then he would know when the next medication was due. We set our alarm. I set the phone alarm that first 2 nights for every 4 hours, and so he would wake up at 4 hours, give me the medications, and then we could go back to sleep. After the 3rd night, I really didn't need to get up in the middle of the night and take it, even though I was still on the Oxy during the day. The lying down, the resting, that seemed to, settle down a lot of the pain. I should say, though, that I do sleep with an ice pack on my neck, even though it's somewhat comfortable to sleep on my side. There's still, when I'm sleeping on my side, I still get pain in this area. So I just take one of these ice packs. Of course, you have to put, so I got cheesecloth is what I got, because you don't want anything thick like a towel, because you're not going to get enough cold, but you don't also want the frozen pack right on your skin, because it will burn you. You won't feel it because you're frozen, but it will burn you. So you put a little cheesecloth or very, very thin kerchief or something like that, and then I just lay it right here, so it's kind of on my throat and on my neck, wrapped around my neck, and then sleep on my contour pillow like that, and then I would be able to fall asleep. When you're on Oxy, you can't really take any kind of sleep meds because it's dangerous. You could stop breathing. So if you usually take things for sleep, you need to check with your doctor first to see if that's okay. And my doctor said that it was not okay. So the other thing that I think really, really helped with, especially the first few days, and it's still helping now, is I bought a wedge pillow system from Amazon. I don't know if you've seen these before, but they come in like 4, 6, or 8 different pieces. I just bought the 4-piece one. And so there's 4 different wedges, and you can configure them in all different ways in your bed so that you can sit up comfortably, lie back comfortably, and have support under your knees, have support under your neck. And it's just absolutely wonderful. They're not super expensive. I think it was about $100, $80 or $100, but it was definitely worth the money. The other thing, this is a really small thing, I think ladies, you'll appreciate this, is that it's really helpful to have lip balm and throat lozenges, because when you come out of that surgery, you're going to be very, very dry. And you don't want to drink too much water or drink too much anything, because there is that risk of nausea and vomiting. So putting on some lip balm and popping in a lozenge is really, really helpful. Or just even sucking on ice chips, which is something they'll offer you in the hospital. But I like the Ricola original lozenges, but you know, whatever feels soothing to you. Let's see, there was one other thing I wanted to mention. Oh, I wanted to talk about eating. So you're not going to be able to eat well, first of all, you're not going to have much of an appetite. But unless you're trying to lose weight, you should try to eat 3 meals a day, or eat some meals each day. I wouldn't worry about it the first couple of days, because you're just out of it. Your throat is so sore, all of that. But you do need to eat a little bit before you take your meds, because otherwise you'll get stomach upset. So I bought a boatload of Costco plain yogurt. And my husband would just mix in a little bit of vanilla, a little bit of sugar, and I would eat a small bowl of that. And then I would take, and you also need the food for the stool softener. So you take the stool softener before you have a meal. But I would eat this yogurt before taking the meds to prevent any nausea and vomiting. By the 3rd day, I started eating regular food, but softened. So my husband made me some pureed vegetable and bean soup. I was eating smoothies. Well, I still am eating these things. Smoothies, I'm still eating yogurts, banana, things like that. There's not a lot of trouble with chewing. It's more about swallowing, and it's not swallowing like it's not scratchy, like I said. It's more that it feels like every swallow is hurting as it's going down into your throat, because they pushed everything aside, which probably stretched everything out and made everything sore. Plus they intubate you. I don't know how they do all that. I don't know how they intubate you plus push everything aside, but they do. And so all of that happening in your throat and your chest, you definitely feel it. So be creative so that you have interest in foods, because if you're just eating yogurt, for a week or two, that's not any fun. So I have splurged and had some ice cream, which was really lovely, because that cold on the throat just felt so nice. The cold smoothies really, really help. I've been eating mashed potatoes. Like I said, the pureed beans. I've been eating porridge, things like that. Things you enjoy, but are just going to be really easy to go down your throat. Not a lot of chewing, and really easy to go down. I was in the refrigerator yesterday, and my husband had some smoked fish in there, and it looked so good. And I thought, well, I'll just grab a little piece of that smoked fish. And I put a little piece of smoked fish, chewed it up, swallowed it. It felt like rocks going down, all the way down here. So the soft food is the way to go. So I don't know when this is going to improve, but I'm just waiting that out. In terms of your energy, you're not going to have a lot of energy. Your body goes through a lot with anesthesia. This is a pretty major surgery. But I am getting out and walking 2 or 3 times a day for about 5 minutes. I do tend to get a little bit nauseated if I'm walking too much, and I definitely feel fatigue. So listen to your body and just stay in bed. Get moving a little bit, because moving is good for healing, and you don't want to be completely out of shape. And oh, by the way, I wanted to mention, if you are thinking about doing this sometime down the road, maybe not like in next month or next week or something, spend some time building your stamina and getting into shape, because I really feel like my stamina and my fitness helped me a lot. So for example, getting out of bed is not easy, even for someone who's fit. Everything hurts, especially, when you use your neck and pretty much everything you do. So when you're getting out of bed, you're engaging your core, but you're also engaging your neck. And anytime you're engaging your neck, that just induces pain. So I would swing my legs over and then take my husband like this, and then he would pull me up. I only needed to do that for about a day and a half. And then after that, I was able to tough it myself. It still didn't feel great, but it wasn't excruciating like that first day and a half. But that's why I say you need this full-time caretaker. You need this person that's going to help you when you need to go to the bathroom, who's going to, refill your water, take your meds to you, give you your food, all the things that you need to do. So you really do need that nurse for at least 48 hours. By the third day, I was able to get up and walk around, go to the bathroom on my own, even make a little food for myself, and started to feel a little bit more independent and a little bit more hopeful. So I think I've covered everything that I wanted to. Let me just look at my list here really quickly. Okay. Oh, I did want to talk to you about where I'm still feeling pain 1 week in. So I have never really had a lot of incision pain. So like I said, my surgeon gave me some sort of, I don't know if it's a nerve block or if it was just long-acting lidocaine, but I felt no incision pain coming out of the surgery, and really didn't even notice my incision until the next day. And even when I did notice it, it wasn't super painful. So, because it's closed, it's glued. You can't see it anymore, but this was very bruised around here. And I had some yellowing from, the tail end of the bruising a couple days ago, but that seems to be gone. And as you can see, my incision is healing really, really nicely. I mean, this is only a week, and you should have seen it a week ago. It was pretty gnarly. So that's coming along really nicely. So there's not a lot of pain there. Obviously, if I bump it or something like that, then I feel pain, but it's very quick and it goes away very quickly. I showered today. I was able to wash my hair and put makeup on, which feels pretty good. And my surgeon said, just, let the water, don't wash it, but just let the water run over it and then pat it dry when you come out of the shower. You might have different instructions from your surgeon, and you should follow what your surgeon tells you. If you have a bandage, they're going to want to have you keep it on and so forth. So in terms of where my pain is now, 7 days in, it's still really painful to swallow. I'll swallow right now so I can just give you a sense of what it's like. So when I swallow, the pain just moves down here and spreads out into the muscles in my chest. So I'm feeling whatever it is, your larynx or whatever it is that, the saliva goes down, I can feel that pain. And then I feel pain through here. I feel some pain, achiness in my neck, and quite a bit of pain yet through this area. And that's where the ice packs and the heating pad really come in handy. So that, manages the pain. And right now I'm just on the tramadol and the muscle relaxers and the ice and the heat. I'm still on my wedge in bed, but I am able to get up, make my own breakfast, My husband did my laundry, brought it into the bed. I even folded my own laundry today. And obviously I'm making this video, so up and around enough to be able to do that. So if you have any questions, feel free to post them. I'll get back to you as soon as I can. And I'm going to post another video in a week so I can give you an update of what to expect after ACDF surgery, 2 weeks post-operative. See you then.